Very warm welcome to everyone. Geneva WHO headquarters, welcome to regular COVID-19 press briefing. We are having journalists watching us on Zoom. We are also having a number of people watching us on a number of WHO social media platforms. Today with us, we have our regular speakers, WHO Director General Dr. Tedros, Dr. Maria Van Kerkhove, Dr. Mike Ryan, but also we have today with us Dr. Janet Diaz, who is the Head of Clinical Care within the WHO Program for Emergencies. Journalists who are watching us on Zoom can listen to us in 6 UN languages, plus Portuguese, plus Hindi, thanks to our interpreters who are here with us, that we thank for making this possible. You can also ask your questions in those 6 UN languages plus Portuguese when we arrive to the session of questions and answers. And I'll give the floor to Dr. Tedros for his opening remarks.
Thank you, Tariq. Good morning, good afternoon, and good evening. More than 9.1 million cases of COVID-19 have now been reported to WHO, and more than 470,000 deaths. In the first month of this outbreak, less than 10,000 cases were reported to WHO. In the last month, almost 4 million cases have been reported. We expect to reach a total of 10 million cases within the next week. This is a sober reminder that even as we continue research into vaccines and therapeutics, we have an urgent responsibility to do everything we can with the tools we have now to suppress transmission and save lives. One of the most effective ways of saving lives is providing oxygen to patients who need it. Several news reports published today have highlighted the vital role of oxygen in treating patients with severe and critical COVID-19. This has been an area of intense focus for WHO since the beginning of the pandemic. Patients with severe and critical COVID-19 cannot get enough oxygen into their blood by breathing normally. They need higher concentrations of oxygen and support to get it into their lungs. Left untreated, severe COVID-19 deprives cells and organs of the oxygen they need, which ultimately leads to organ failure and death. Medical oxygen is produced using oxygen concentrators, which extract and purify oxygen from the air. WHO estimates that at the current rate of about 1 million new cases a week, the world needs about 620,000 cubic meters of oxygen a day, which is about 88,000 large cylinders. However, many countries are now experiencing difficulties in obtaining oxygen concentrators. 80% of the market is owned by just few companies, and demand is currently further 170,000 concentrators that can be available over the next 6 months with a value of $100 million. In addition, WHO has bought 9,800 pulse oximeters, a simple device used to monitor oxygen in patients' blood, which are being prepared for shipment. Another challenge is that many patients with critical disease need a higher flow rate of oxygen than is produced by most commercially available concentrators. To address this challenge, WHO is supporting several countries to buy equipment that will enable them to generate their own concentrated oxygen in larger amounts. This is a sustainable solution for COVID-19 and beyond, but requires technical expertise for maintenance. WHO has also published technical specifications for the design of this equipment, as well as guidance for countries on oxygen sources and distribution. This is just one way in which WHO is continuing to support countries with science, solidarity, and solutions. As some countries start to reopen their societies and economies, questions about how to hold gatherings of large numbers of people safely have become increasingly important. This is especially true of one of the world's largest mass gatherings, the annual Hajj pilgrimage. Earlier this week, the government of the Kingdom of Saudi Arabia announced that this year's Hajj will proceed with a limited number of pilgrims of different nationalities who live within the kingdom. This decision was made based on a risk assessment and analysis of different scenarios in accordance with WHO's guidance to protect the safety of pilgrims and minimize the risk of transmission. WHO supports this decision. We understand that it was not an easy decision to make, and we also understand it is a major disappointment for many Muslims who are looking forward to making their pilgrimage this year. This is another example of the hard choices that all countries must make to put health first. Finally, tomorrow the government of the Democratic Republic of the Congo is planning to announce the end of the Ebola outbreak in the east of the country after almost 2 years of struggle. In total, there have been almost 3,500 cases, almost 2,300 deaths, and almost 1,200 survivors. WHO is proud to have worked under the leadership of the government of the DRC to bring this outbreak under control. This has only been possible thanks to the service and sacrifice of thousands of Congolese health workers working side by side with colleagues from WHO and many other partners. I salute them all. Many of the public health measures that have been successful in stopping Ebola are the same measures that are now essential for suppressing COVID-19. Finding every case, isolating every case, testing every case, caring for every case, and relentless contact tracing. These are the measures that must remain the backbone of the response in every country. There are no shortcuts. But Ebola and COVID-19 are only two of the health threats facing the people of DRC and many other low and middle-income countries. That's why WHO is committed to continuing to work with the people and government of DRC to strengthen its health system and support it on the road towards universal health coverage. I thank you.
Thank you, Dr. Tedros, for these opening remarks. We will open the floor for questions now. We wish to remind you, if possible, to be short and have one question per person. And again, you can ask your question in 6 languages plus Portuguese, if you wish to do so. We will start with Peter Kenny, who works from Anadolu today. Peter, do you hear us?
Yes, do you hear me?
Yes.
Thank you. I would like to ask my question about research on vaccines in Nigeria at Adeleke University in Nigeria's Edo State. They have discovered a vaccine. I would like to know about what type of research is going on in Nigeria. And thank you.
So thank you for the question. I can't answer specifically about the vaccine that you mentioned in Nigeria, but I can tell you that we are working with researchers all over the world, including many researchers across Africa, across a number of technical areas, whether this is through epidemiologic studies and seroepidemiologic studies, whether it's clinical research, whether it's the development of vaccines. And so while I don't have anything specific on your specific question, I can tell you that we are deeply engaged with academics, with public health professionals across Africa who participate in our international networks and who also participate in our R&D networks where we accelerate the advancements of research for COVID-19.
Thank you, Dr. Van Kerkhove. Peter, if you send us an email, we may try to look for particular information on this through our regional office as well. Let's now turn to Antonio Breto from FA News Agency. Antonio? Antonio, can you just unmute yourself?
Sí, hola, buenas tardes, gracias.
Good afternoon. Thank you for giving me the floor to ask this question. I would like to look into the situation right now in Latin America. What are the characteristics in the clusters of the epidemic there compared to other parts of the world? And could you confirm or not the figure that statistics say regarding the fact that there will be more than 100,000 deaths in Latin America? Is that correct or not?
I can begin, Maria will follow. I think it's difficult, number one, to predict the number of deaths per se, but what we can do is the epidemic in the Americas in general is still intense. It's particularly intense in Central and South America, and it's across a range of countries. And we've seen a steady and worrying continuation of trend, with many countries experiencing between 25 and 50% rise in cases over the last week, which means many countries in Central and South America and in the Americas in general are still suffering sustained community transmission. And as such, the journey for them is unfortunately, the pandemic for many countries in the Americas has not peaked. They are not reaching a low level of transmission within which we can achieve a sustainable exit from public health and social measures, or extreme public health and social measures. So I would characterize the situation in the Americas in general, and in Central and Latin America in general, as still evolving, not having reached its peak yet, and likely to result in sustained number of cases and continued deaths in the coming weeks. The extent of those deaths and trying to predict those numbers, I think, is not helpful at this point. But again, we would really stress to governments in the Americas that there needs to be an all-of-government approach. There needs to be very clear communication with citizens around the measures that are to be taken for self-protection, for community response. There needs to be a very sustained investment in public health infrastructure and the capacity to isolate or test and trace and isolate, and capacity to quarantine contacts. It is very difficult to take the sting out of this pandemic or out of this epidemic in the country unless you're able to successfully isolate cases and quarantine contacts. In the absence of a capacity to do that, then the spectre of further lockdowns cannot be excluded. And really, I don't think anybody wants to go back to population-wide, society-wide lockdowns, but the only way in some circumstances to avoid that now is a very, very, very aggressive investment in our capacity to detect cases, confirm cases, quarantine contacts, and keep our communities on board and willing, able, without coercion, to support clear messaging and clear instructions and requests from government in a trusting environment. I can't stress that enough.
Only to add, I fully endorse everything Mike has just said. The only thing to add is, a worrying trend we're seeing in the number of positive cases for COVID that's coming from the respiratory disease surveillance system, the ILI, or the SARI surveillance system. In PAHO, in the Americas, the positivity rate is between 30 and 40% of those samples that are tested for ILI, or influenza-like illness, or SARI, severe acute respiratory illness. So this is outside of the active case finding for COVID-19. So that means that the virus is circulating. And in many countries in the southern hemisphere, in the Americas, they're entering their flu season. They're in their flu season. So you will see an increase in respiratory diseases, which will complicate the ability to care for them because you may not know if somebody has influenza or if they have COVID-19. And so that will make the picture even that more difficult to understand, which is why it's so important that surveillance systems that Mike has outlined are in place for COVID-19, but also that systems are also testing for influenza. So it is difficult to give one summary of a large region with many countries and many different climatic zones, which are some are dealing with influenza and others are not.
Many thanks. We'll now turn to Maya Plants from UN Brief. Maya. I understand. Let's just try one more time with Maya, if it's possible. If not, then let's move to Reuters, and we have Emma Farge. Emma, can you hear us?
Good afternoon. A question for Mike Ryan, if I may. Dr. Ryan, in the past you used the term driving blindly to describe some countries moving out of lockdowns. And I'm wondering, given the concerns raised by the medical community in the UK, does that description apply there? Thank you.
It's difficult to make specific comments on individual governments, but I would say in the United Kingdom has been very much guided by a very steady, slow, stepwise exit from lockdown conditions. The government did set out some very specific parameters and metrics for how they would do that. I think they've communicated those to population, certainly to us. And in the different 4 home regions there, you have England, Wales, Scotland and Northern Ireland. The chief medical officers and the governments on those 4 entities have worked together in a consistent way to implement that, if some slight modifications of that. So from that perspective, testing in the UK has increased. I believe the surveillance system is capable of understanding where the disease is. I think the question we ask now for many countries is the public health system not just doing testing, but is it actually detecting cases as soon as possible after those cases become unwell? Are we immediately identifying their contacts? Are we in a position to quarantine contacts? In other words, that contacts are either quarantined at home or quarantined in a third place or a second place, and our contacts supported in that quarantine and traced over that time, with or without the support of electronic tools or apps. And I think this is a question that's facing many countries now, because countries have fought hard, including the United Kingdom, have fought very hard, and populations have sacrificed a lot to drive transmission down. It's taken time. It's taken its toll on people personally. It's taken its toll on communities. It's taken its toll on the economy. The reward for that are low levels of transmission across society. But as we've seen, the risk of that jumping back up in particular circumstances, in crowded situations, super spreading events. So we must be able to reap the harvest as such of such a sacrifice to shut down and lock down and drive transmission down to a low level. That transmission needs to be kept at that low level and driven even further down. That is going to require extreme vigilance. It's going to require communities staying on board, individuals understanding their responsibility, their contribution to their own protection, to the protection of others that are involved in this process, and taking ownership and feeling empowered and supported by the authorities. And that the authorities are able to react quickly to each case, confirm the presence of the disease or not as quickly as possible, turn around testing very quickly, and isolate cases when confirmed and identify all their contacts and quarantine those contacts. I'm sorry for continuing to repeat this, but there are no silver bullets, there are no easy answers, and each government, including the UK, needs to examine itself at every level and say, are we capable of doing that? Is every part of this system able to keep its promise? I, as an individual, promise to keep myself safe, and I promise to do everything to keep other people safe. Communities promise themselves that they will keep each other safe. Governments promise citizens that they will keep their citizens safe. Everyone has got to now live up to the promises they make, the commitments they make, and people have got, everyone at every level needs to follow through. Because what we've seen in countries that have implemented comprehensive strategies, that have reacted quickly, that have operated across multiple levels of strategy, implemented all of the things that I've just previously mentioned, they've done reasonably well and they've avoided the worst of the lockdowns. I think we've all collectively learned a lot. The issue now, and the Director General is leading a process inside our House right now, really looking at this. What have we learned in the last 6 months? What have we learned through all of these sacrifices? What have we learned about the virus? What have we learned about how to control the virus? What have we learned about our capacity at community and government level to sustain response in a coherent way, in a coordinated way? What have we learned about that? Are we willing now to learn those lessons and face the next 6 months with the resources we have? We have the tools to suppress the transmission of this virus. We hope dearly we will get an effective vaccine, but we cannot count on that. And the Director General has challenged us internally and will challenge our partners to have that discussion in the coming weeks so that we can face into the summer and into the autumn and into the rest of the year using the tools that we have in the best possible way. So in summary, I would say yes, the UK has taken a stepwise approach. The UK is listening to science. Science is still driving decision making. And yes, every government, every level, there are setbacks, there are surprises, but the stepwise approach in the UK is the right way to go. And we just hope that all systems, including the UK, can put in place the necessary surveillance to support this going forward.
So just briefly to add some of the things that we are learning, because it is important that we look and we learn from many others. And one of the things, as countries are lifting the lockdown in this slow and staggered way that we've been talking about, is the ones that are seeing some success are doing this in a data-driven way. They're using indicators. They're using values of transmission, not only the numbers of cases that are declining, but the numbers of deaths. What do those trends look like? Looking at the reproduction number over time, looking at their testing. Are they seeing a large proportion of those tests that are actually carried out positive, or is it at a low level? They're looking at their bed occupancy. How full are the hospitals in terms of dealing with mild patients or even severe patients needing ICU? What are the isolation facilities, other isolation facilities and quarantine facilities? Are they full? How many contacts are traced? How many cases are coming from contact lists? These are helpful indicators to know where you are in your transmission scenario. And while doing this, we're seeing countries take this phased approach. You've seen phase 1, 2, 3, 4, and the slow movement of those phases, periodic, looking at it after a few weeks. Can we move to the next phase? Are we seeing that low level of transmission? And all the while having this direct engagement with their populations and with their neighbors, the populations either in a neighboring province or a neighboring state or a neighboring country. Are they seeing the same levels of low suppression of transmission? All of this is quite helpful in terms of helping others to see how is it working in your country so that we can learn from each other. But this is what we mean by a data-driven approach, constantly looking at the epidemiology, constantly looking at the data that is being collected to determine what is that next step. Can we lift even further, or do we actually have to implement again? And keeping the population engaged so that they know exactly what they need to do in each phase.
Many thanks. We will now go to Mexico. We have Paulina and Cadena. Paulina, can you hear us?
Hola.
Hola.
Thank you, Tarek. Thank you for listening to my question. We have a doubt. What recommendation could you give healthcare institutions or recommendations to to patients that have given up on treatment, whether it's cardiovascular treatments or cancer treatments, because they don't have, we don't have specific hospitals. Right now, we have hospital occupancy that's at 30% in Cancun.
Thank you for that. It's actually an incredibly important question to understand how to keep essential health services going. There are, chronic conditions that continue that those patients need to continue to have, their care continued. In this type of situation, you consider alternate delivery platforms such as telemedicine, nursing calls, telephone calls, other ways in order to ensure or to ensure that the patients can get the medical care that they need for their chronic conditions. In addition, when you consider even prescriptions, if you usually give 1 month of prescriptions, then the alternative would be to give 3 months of prescriptions or 6 months of prescriptions in order to ensure that those patients can continue their medications. And I will refer you to our colleagues here have published operational guidance on how to maintain essential health services with very easy to use checklists and other essential information that are looking at these different types of patients that may have more limited access during the COVID pandemic.
Thank you very much. This was Dr. Janet Diaz, our head of clinical care. And now we will go to Brazil. Bianca Gautier from Global. Bianca.
Hi, Tarek. Can you hear me?
Yes.
Thanks a lot for taking my question. Dr. Ryan said that the Latin America has not yet reached the peak. I would like to ask him, to ask you, Dr. Ryan, could you comment specifically about Brazil? How far is Brazil to reach the peak? Some say July, August. Do you have something in mind?
Again, and thank you for the question, but it's very difficult to predict peaks. If you look across Europe, you look across the rest of the world, you look across the Americas, the peak has an awful lot to do with what you do. What you do affects the peak. It affects the height of the peak, it affects the length of the peak, and it affects the trajectory downwards. That is everything to do with the government's intervention to respond, the community's cooperation with that intervention, and the healthcare and public healthcare system's capacity to act. The virus doesn't act alone. The virus exploits weak surveillance. The virus exploits weak health systems. The virus exploits poor governance. The virus exploits a lack of education and a lack of empowerment of communities. Those are the things we need to address. If we address those things systematically, the numbers will go down. That is what's happened. That is the reality of this pandemic. The numbers respond to response. And there are no magic answers. There are no spells here. You can't divine this away. We have to act at every level. We have to use the resources at our disposal. And country examples, not from WHO. Just look around the world. Look at the countries that have taken action. Look at the countries that have contained and controlled this disease. And you'll find your answers.
I just want to add that, again, fully endorse with Mike has just said, that transmission is completely in our hands. And it's not only in our individual hands, but what we do as individuals to prevent ourselves from getting infected, to prevent our families, our communities, our populations. And we have outlined steps that need to be taken at each level of transmission. We've just published an update of this guidance today, which is focused on critical preparedness, readiness, and response actions based on if you are in a situation of no cases, either you haven't had cases yet or you've actually brought those cases down to zero, where you have sporadic cases, where you have clusters of cases, where you have community transmission. And in this document, it outlines actions, detailed actions that need to be taken for everything from your emergency response mechanisms, risk communication, surveillance, IPC, clinical care, public health measures. And there's a link to every additional guidance that WHO and our partners have put out. And it's the closest thing we have to an actual action checklist that's online. And it just to highlight that there
function, they can be physical